All right. Thank you everyone for joining us tonight for our Tough Topics discussion. The Tough Topics series was created to provide a safe space to ask questions about topics you may be afraid to ask about. As librarians, we are here to help, not to judge. The 2020 Tough Topics series is presented by Shreve Memorial Library in partnership with the Louisiana Department of Health, Office of Public Health Region 7, and focuses on discussions of opioid addiction and substance abuse. Tonight, we have joining us from Northwest Louisiana Human Services District, Karla Gipson, Primary Care and MAP Provider, and Juanita Jones, Director of Intake Department. Together, they will tell us all about treatment and substance abuse services available in our area. Before we begin, I would just like to remind everyone to please keep your screens on mute during the discussion and to submit any questions you may have through the chat feature. If you wouldn't mind taking a few minutes just to complete the brief pre-survey questionnaire before we get started, the survey link is available in our chat box. So now, without further ado, ladies, I will turn it over to you.
Good evening, everyone. My name is Karla Gipson.
And I'm Juanita Jones.
And this evening we will be discussing with you the treatment and substance abuse services that we provide here at Northwest Louisiana Human Services District. Our disclosures, between the two of us, no financial disclosures, no conflict of interest. Our objectives for this evening will be to let you know who we are, what we provide, as well as our intake process. The Northwest Louisiana Human Services District provides mental health services, addiction services, and developmental disability services to the residents of not only Caddo Parish and Bossier Parish, but also Bienville Parish, Claiborne, Natchitoches, Red River, Sabine, and Webster. So let's get started. What exactly is MAT? Medication assisted treatment. A lot of times you'll hear it's called MAT or MAT. MAT is an evidence-based program that is used to treat substance use disorders. You can break it down further into medications that are used to treat either alcohol use disorder or opioid use disorder. These medications assist in reducing cravings, treating withdrawals, blocking subsequent drugs, preventing overdose, and overall helping clients to return to their baseline. When you hear MAT, people think of it as exchanging one drug for another. This is not true. MAT does not get patients high. It does not impair their function. And in fact, it helps them to, again, reduce cravings and to also treat withdrawals. I like to give an example of one that's called buprenorphine. It has what's called the ceiling effect. So once you take an amount of buprenorphine, you reach an effect where no matter if you take more, you won't get any additive effect. So it has what's called a ceiling effect, unlike your hydrocodone or your oxycodone, which does not have a ceiling effect, and that's the reason why it's considered so addictive. So a lot of times when you hear people saying it's just trading one drug for another, that is not true. It is to help and not hinder our clients. So MAT has been shown to improve patient survival by preventing relapse as well as preventing overdose. It increases retention in treatment. It decreases illicit opiate use and other criminal activity with people with substance use disorders. It increases a patient's ability to gain and maintain employment. It gives them a sense of being able to live again, where they're not dependent on their next high. It improves birth outcomes among women who have substance use disorders and that are pregnant. So what MAT services do we specifically provide at Northwest Louisiana Human Services District? We have injectable medications such as Vivitrol, which is used for alcohol use disorder. We also have Sublocade, which is buprenorphine, which is also an injectable that is used to treat opioid use disorder. We also do oral naltrexone for alcohol use disorder, but again, for opioid use disorder, we only do the injectable, which is the Sublocade. As far as your Sublocade goes, we typically bring in our clients and they're either have already been on Suboxone or Subutex. And so we can begin the process of starting them on Sublocade, which are Sublocade injection. You have to actually initiate 2 doses in order to get them to where they need to be. But prior to that, if they haven't already been on Suboxone or Subutex, they have to do a 7-day induction period where we can make sure that they're going to tolerate the buprenorphine. So after they do that 7-day induction, or if they've already been on it, we can get them started. And on month 1, they receive 300 milligrams of Sublocade. And then at month 2, they receive another dose of 300 milligrams of Sublocade. And by that time, they reach a therapeutic level, and then they can begin their maintenance. And in their maintenance dose is 100 milligrams. However, if you have a client that is still having withdrawal symptoms with the 100 milligram, you can bump them back up to the 300 milligram. And that goes back to the amount of Subutex or Suboxone that they were on, or if they maybe have been an IV heroin user and their dosage that they were using was a large amount, sometimes clients will have to be maintained on 300 milligrams. So again, they'll either do their 7-day induction of being on either Suboxone or Subutex. If they've already been on that, then they can automatically just start their Sublocade, and it's month 1 and month 2 of 300 milligrams. And then they begin that 3rd month of their maintenance dose, which is 100 milligrams. But if they're still having withdrawal symptoms, then they can be given the 300 milligram, and they can maintain on that. With the Vivitrol, it's just they start it and they do a 7-day trial to see how they're going to tolerate the oral naltrexone. And then if they tolerate it well, then they can begin their Vivitrol. Vivitrol is 380 milligrams for the initial dose as well as the subsequent doses, and it's given monthly every 4 weeks as well. And it's our IM injection. Some clients do the oral naltrexone and they tolerate that as well. So if they want oral for alcohol use disorder, they can do oral or injectable. But again, for our opioid use disorder, it's only the Sublocade. As far as the recovery process goes with our clients with substance use disorder, if they are currently in our clinic and they're receiving the Sublocade or the Vivitrol, they're also required to receive psychotherapy, whether that is inpatient, intensive inpatient, or whether it's individual or group, whether it's 2 times a week, or we even have night, group that we offer. So there is something for everyone. But in order for them to be a client here and receive services for substance use disorder, they have to agree to also receive therapy in the form of either individual or group. And those clients also can move up and down where we see fit if they're recovering well. If something happens where they have a setback, then we can also bump them up for either intensive outpatient or bump them back down. If we see fit that where they need to go and do inpatient, then we can have the resources available for them to be sent to inpatient as well and then return to us. And those are things that will be further discussed by Juanita.
All right, so thank you, Karla. So now that we know what MAT is and kind of how that process works, how can we get those services? Clients are able to access services through the Human Services District 2 ways, either through referrals or through our internal intake process, which is really easy. All the client would need to do would be to call our clinic at 318-676-5111 to request those services. And one of our intake staff will do a screening and get that process started for you. So typically, when it's not COVID times, We also offer the ability for clients to walk in, and we hope to be able to resume our walk-in services in the very near future. And so we hope to have that, like I said, very soon. However, as of today, the way to access the services would be to call the office for those services. We also, within the Human Services District, have the Office of Developmental Disabilities. And so their office has services available through the same process by calling their office, and I will have those numbers on one of the upcoming slides. Okay, there we go. So we have 4 clinics. We have the Shreveport Clinic, which is here at 1310 North Hearn. We have our Natchitoches Clinic on Medical Drive. We have our Minden Clinic. So the clinics in Shreveport, Natchitoches, and Minden all offer services for both mental health and addiction services. And the services in all 3 clinics can be accessed the same way, through calling and speaking with the intake person so that a screening can be done and intake appointment set up. And then the Developmental Disabilities Office is there on Old Minden Road over in Bossier, and their phone number is 318-741-7455. So in addition to the services that Ms. Karla has already talked about, we want to make sure that we let you know that quite often individuals who have a substance abuse disorder have some type of concerns related to their mental health as well, because we know that addiction problems tend to carry over into pretty much every area of an individual's life. And so we definitely want to encourage the therapy components, and we want to make sure that clients are getting assistance for all of those different areas. So for services here in the clinic, like Karla mentioned, we treat children from approximately 5 years old until 18, and then our services transfer to our adult unit, where we treat from 18 on up. We treat a wide variety of mental health disorders. And so regardless of whether or not the client is seeking mental health services or addiction services, the process is still the same. Once that initial screening has taken place, we go through our intake appointment, and then the client is scheduled with the doctor and the therapist for their counseling and ongoing treatment.
And piggybacking on some of the things that Juanita discussed, I know you have several clinics around the Shreveport-Bossier area that provide MAT services, but what I like to say that stands out from those clinics and what makes us a special service, I guess I would say, is the fact that we have, not only do we offer the medication-assisted treatment, but we have that extra component where we have trained addiction counselors that are on hand to not only, if I'm the MAT provider, so if I'm providing them with the medications to help with the withdrawals, to help with the cravings, but then we have those addiction counselors who are set in place to talk to them about what led you here. Let's get down to the basics of what made you go to that substance, what made you use, what made you to continue to use, what made you sober up, what made you relapse. And so you have counselors that are on hand to teach them and let them identify their triggers and actually talk about the disease process of addiction. And not only that, to help train them and teach them regarding the coping skills that they can use, so that when they're faced with something that may have pushed them to use in the first place, instead, now they have coping skills that they can use that will prevent them from, as well as having the medication on board to help with the withdrawals and the cravings. So I think the combination of the medication as well as the therapy combined proves better and better patient outcomes and yields positive patient outcomes versus just, you know, going to some of the clinics around that just have that one component of MAT services. I also feel that added mental health services helps too, because 9 times out of 10, when you have someone that's suffering from mental illness, they're also suffering from substance abuse. And if they're suffering from substance abuse, sometimes 9 times out of 10, they're suffering from a mental illness. So if you can separate those and treat them, and why not treat them here, because they can be treated under one umbrella, then you'll help in that person to maintain and return to a baseline where they can actually maybe carry on being able to have a job, maybe be able to, you know, go back to school or college, or just those simple things that they couldn't do before because they had an untreated underlying mental illness, or they had a substance use disorder that where they were just hit and miss here and there, in and out of treatment. So being able to have all of these components under one umbrella where I can treat you for your mental illness and I can treat you for your substance use. And not only do I have addiction counselors to help you learn and gain more insight on your addiction, I also have mental health counselors who can help you learn skills and the various, DBT and CBT and those different therapies that they use to help you learn coping skills to also cope with your mental illness. Even on top of that, under this umbrella is I'm a primary care provider. So I have a certification as an MP to provide primary care. So then you have that added entity of ensuring that they are taken care of as far as their physical health. If they do not have a primary care provider, then we are calling and getting them set up with primary care, because your physical health is just as important as your mental health. So under that umbrella, if I can get your blood pressure and I can get your diabetes under control, as well as give you medication assisted treatment, as well as treat your mental illness, all under one umbrella, with that added component in of therapy, I am treating this client as a whole, and that most definitely will yield the best outcomes for them. So I think having all those entities under one umbrella is amazing. Along with that, we also do and can refer out to have our clients have testing done. Because of course, if they have a history of addiction and maybe they were an IV drug user, then we're looking at the risk of them developing hepatitis C. So of course, being a primary care provider, not only can we refer them out to have testing, but if they're positive, then they can also receive treatment. So being able to provide all of these entities under Northwest Louisiana Human Service Districts, I think sets us apart from every other MAT provider around. And I think overall, it just makes for a better patient outcome, and they just can get back to their sense of their baseline.
Absolutely. So I think at this point, it's really important to address, so how do you do all those things, Ms. Karla? How do we make this happen? And so once we get through that, what sounds like a really simple process with our screening and our initial assessment, the initial assessment process really does take a very close look at basically every avenue of the individual's life, so that we can figure out what all these things are. And we are constantly assessing from day one until the very last day, what are the client's needs? Because quite often, clients do come in with a wide variety of issues. And sometimes we don't realize on day one how much the substance abuse may be affecting a different area of the life, or how other areas of life may be contributing to mental illness or addiction. And so it's really important that we do continue that assessment process through the entire treatment episode that we're having with the client, so that we are able to do all of those different things and address all those different areas that the client may be having problems with. And then also, as we go through treatment, new problems do arise. Sometimes we find like, well, the husband may stop using, but their significant other hasn't. And so then that may create some marital issues, or there may be issues where there's legal involvement. And so we're able to help the client not only get to a point where they're abstinent from the substance, but also to try to help them deal with just coping with life without the substance and all the changes that come along with changing your lifestyle.
I think Juanita covered it. She just said, to understand how you get in, how you get started, and just being able to, of course, use all of those resources that we have, and other things that we provide as far as, having the contracts to be able to help, those with housing and just other resources that you may find that they need along the way. So they start at the top, and we just work through to get every aspect of their life and get them what they need so that they can return to, their baseline, whatever their, way of life prior to their use or prior to being, diagnosed with their mental illness. So I think at this time, we've pretty much covered our services, what we provide. And so I guess we could open it up for anyone that has any questions or about our services, how you get started, what we offer. Do we have anyone with any questions, any comments?
Right now, we don't have any questions, but we do have comments that say this is a fantastic service model and that you guys are offering amazing services. I would like to just have you real quickly go back over what exactly MAT is, because we had some people that came in a little late to the presentation. So I think that might be a little helpful. And if you could talk about what it is exactly and why it's beneficial.
Okay. So when we hear the word MAT or MAT, it's basically medication-assisted treatment. Medications that help with substance use disorders, specifically alcohol use disorders or opioid use disorder. It assists in reducing cravings. It assists in reducing withdrawals. It blocks subsequent drugs, and it also prevents overdose. And the treatment component is MAT is just like any other medication. You give it just like you would give a medication for high blood pressure, just like you would give a medication for anxiety. It treats symptoms. So if they come in and they're craving or they're having withdrawals, then we can provide them with the medication that will help with that. Just like if they're coming in and they're having, issues with depression, then we give them an antidepressant. Because I was talking earlier that a lot of times you hear the stigma of MAT is just when you're trading one drug for another, but that's not the case. MAT, those medications do not get patients high. They do not, impair their function. They treat symptoms. Just like, again, your medications for anxiety help with anxiety symptoms and treat those. Your medication-assisted treatment, treat those symptoms. It is symptom-based treatment. It is not getting a patient high, and it is not treating one drug for another. And so when we go into the types of MAT, well, why MAT? It improves patient survival, increased retention in treatment. It prevents relapse. It prevents overdose. It helps patients to go back to their normal sense of baseline function. And then the last one, it improves birth outcomes among women who have substance use disorder and are pregnant. Again, reiterating the MAT services that we provide. Currently, you do have oral medications that are used to treat opioid and alcohol use disorder. However, for the purposes of our district, we provide Sublocade, which is the injectable form for opioid use disorder, and we do Vivitrol, which is the injectable for alcohol use disorder. But we also do the oral naltrexone as well. But for opioid use disorder, we only cover the and provide the Sublocade. So again, with the medication-assisted treatment, it's just to treat alcohol use disorder, opioid use disorder, to assist in reducing cravings and to help with withdrawals, preventing relapse, and again, helping that person return to their baseline.
Thank you. Are there any other questions? This has been a great presentation. These are a lot of services that you guys offer right there at the Northwest Louisiana Human Services District. I mean, to have the substance abuse along with the mental health and the making sure your physical health is there too, all under one roof, is just amazing.
Exactly. I really think that's what sets us apart from other facilities, is being able to have, I kind of always coin us as a one-stop shop, and we are just that. And if we can't provide it right here, then we know Juanita is great about having a plethora of resources where we can, refer out if we need, that in addition. So not only do we provide a lot of different things under our roof, we have the resources available to refer out to if we need to, if it's something that we can't provide.
Absolutely. I think sometimes one of the questions that I get from time to time is, well, I don't know if I really need that. I'm not really sure. Or, well, maybe my husband or my family member or whomever the person is that we're concerned about, maybe, but we don't really know if they really have a problem. And so I say, have that individual call us, or you call us and let us go through that screening process with you and let us help you decide. Maybe it's not an issue that requires a treatment that is as extensive as MAT, but we do offer pretty much all of the outpatient services that are available for substance abuse or mental health disorders. And so just because we have all of these different things available doesn't mean that every person who comes in needs all of them. And it also doesn't mean that you have to know this is what you need the day that you call. Sometimes it takes having that conversation with one of us to try to help you realize or to maybe reconfirm for someone who's thinking maybe this is the right thing for them or maybe it's not. And so if we get into a situation where there's a need for a service, like Karla said, that we don't have available here, we will do everything we can to assist you in finding a provider that can get you the services that you need. Because again, our goal is to treat that whole person and to help people have better outcomes.
Awesome. We do have a question, which I think is a really good question. The question is, what if someone needs treatment but doesn't have insurance?
It's not a problem at all. Here in our office, we one of the steps in our process is that we do a financial assessment for every patient that contacts us for services. And so as part of that process, if an individual has no insurance and has not recently applied for Medicaid services, we have staff that have been trained by the Medicaid professionals themselves to fill out those applications, so we have a greater chance of those being approved. And then in the event that an individual does not have insurance and does not qualify for Medicaid services, we have a sliding scale. So that would be determined based on either the past year's tax returns or the last 4 check stubs. So we certainly have a way to help clients regardless of what their financial situation might be.
Awesome. I have just a follow-up question to what you mentioned before. If you had a family member that you thought might need help and they were over the age of 18 and you called and just kind of did the pre-screening questionnaire, like how would you go about getting them in to see you guys?
So I think that is a really good question. And honestly, the answer is it's as unique as each individual is. In some instances, when a family member calls in and they just express that they're having concerns, it just really depends on the family dynamics. Sometimes we can have a conversation with a mom, sister, cousin, friend, and just give them enough information to feel comfortable just approaching the subject. And then in other cases, we might need to provide literature. Obviously, when we have our services open where we're able to walk in, we've had people just put folks in the car and drive them on over and let's just sit down and talk about it. But at any rate, if the individual can provide us with a telephone number or some other means of contacting the potential client, then we will reach out to them and offer the service to them.
Awesome. Okay, are there any other questions? Well, we don't have any other questions, but is there anything you can maybe tell us about what you see as some of your most used services that you guys provide? Or would you have an idea?
Yeah, like I said, it's a really good question. I think honestly, at this point, we pretty much are kind of even across the array. I mean, we have so many individuals that have mental health concerns. We have quite a few that have addiction issues. We have several that have both. Yes. Maybe more so individuals that receive a little bit of everything. Just because, like we said, you know, looking at that whole picture and the whole family. Caddo Parish, I think, is maybe not unique, but certainly moving towards the forefront in our legal system with working on ways to not keep people incarcerated due to either mental health or addictions. And so right now, one of the things that I think is really interesting is that we have a partnership with the court systems in Caddo as well as DeSoto parishes. And we're working on getting connected more closely with Bossier. To where the court system can identify someone who maybe is a repeat offender or something of that nature and send them for an evaluation to help us figure out, you know, is there something going on in this person's life that maybe some treatment might help? So I do think here recently we've seen, especially with COVID, we've seen quite a few referrals through the legal system. And so I think that's one of those things that kind of sets us apart, like we were talking about before, is just having the ability to try to help people truly become just more productive and more healthy in their global life, to be able to have their needs met. And you know, what a great privilege it is for us to be able to help people maybe avoid incarceration or just avoid having, you know, additional time, whether it's 2 weeks or 2 months, any time frame that you're just in the throes of an addiction or any kind of mental health problem. Every day that you spend in the middle of that is just one day too many. So we say, just reach out to us, give us a chance to talk with you and let us figure out how we can help you move in the right direction.
Exactly.
That's awesome. Real quick, I think if we could go back over the slide that had all the phone numbers for the clinics that are in our area, and just the intake process, they just call those numbers. I think that would be helpful. I typed the Shreveport number in the chat box for those who may not have caught it when you're going through, but I think we could just take a few minutes just to see the slide one more time. It might help for those who are looking to get some help.
Yes, I'm sorry, I completely neglected to mention, we actually have a website for our Human Services District as well. And so there, all of the information for all of our clinics is at the website at www.nlhsd.org. There is also the availability on that website for an individual to enter a question or a concern and have it be sent via email to one of our providers, and then we can reach out to them as well. So we say quite often with mental health and addiction, the key to being able to get someone help is to get them help when they're ready to get help. And so I do really want to take that opportunity to say, like, if you're having that conversation now on Friday night at 7 o'clock with somebody saying, we really need to get you some help, we really need to get an appointment with someone, you wouldn't be able to schedule the appointment, but you could certainly reach out through the comment section on the website. And then that way, Monday morning, as soon as we get that information, we can reach back out to the client to try to get that process started as quickly as possible.
And also too, for those that are on social media, Northwest Louisiana Human Service District, if you type that into the search bar on Facebook, we also have a Facebook page. And from there, you can see information of upcoming events, different things that are going on with the district, all kind of community health fairs. There are different things that we share about things that are being offered in the community to help our clients as well. So there's a lot of information, and that Facebook is updated, frequently with all sorts of useful information as well as resources as well. So if you're on Facebook, type in Northwest Louisiana Human Services District and check us out.
Awesome. We will definitely do that. It doesn't look like we have any more questions in the chat box, but I think before we kind of wrap this up, I would just ask each of you, what is the one thing you want us to take away from this presentation? There's so much that we've learned tonight, but if there's just one thing that you would like for us to take away from this presentation, I just ask that you guys let us know what that is.
The one thing that I would say to take away is, if you or a loved one or anyone that you know needs help and may be suffering from addiction, from mental illness, or both, Northwest Louisiana Human Services District is your place to go. We have so many valuable resources under one umbrella to really help you get to where you need to be. I just really think that we're very unique in the services that we provide, and we just are dedicated to helping our clients to just, like you say, have the best health outcomes that they can have. So my takeaway would just be that, know that we're there, know that we're available, know that we provide MAT, addiction, mental health, or both.
Absolutely. I don't know if I can say it any better than Karla did. Definitely, when in doubt, reach out. Because we're here, we have the privilege of having an intake team here that is dedicated to answering those questions. So we certainly do not ever want a potential client or family to feel like they would be bothering someone or that someone would not have time for them. We have that dedicated team that can help work through figuring out what is it that's needed. So we certainly want to do that. We have a couple of little slogans here. We say recovery begins here. We're just waiting on you. And then, our team mantra is just keep hope alive. As long as you've got a little bit of hope and just a little bit of effort towards reaching out for a service, we can certainly help you get to where you need to be and have that happy, fully productive life that so many people are having a struggle with right now.
And then also to piggybacking on what Juanita was saying, the fact of when I look around and you see different facilities that provide the service that we provide, I think what too stands out for us is having that component of being able to provide medication as well as therapy. I think sometimes people get one or the other, but I think the combination of both is really what pushes us towards having successful cases where people end up, just being able to function again, is having that medication to treat those symptoms, but also having that therapy component to teach those coping skills, to help you when you're triggered, or to help you when life throws you, a monkey wrench, and you just knowing you can resort back to, back to what your counselor has discussed with you, to be able to get through that moment. And then also having the medication. I really think those combination of services, as well as, the primary care component of referring them out to have physical health, as well as, their mental health, I think those things really set us apart from any other facility.
Karla, the one thing that just really rings true for me, and I don't know why I didn't think of it earlier, is like you mentioned with other disorders, and we talk about all the different things that we do. I do think that it's important to just remind people that we know historically, reaching out for mental health or substance abuse services has had a really big stigma, but it's really important, I think, to all of us here to try to help our clients and the community at large to just realize that mental health disorders and substance abuse disorders are medical problems. And so, just like you would call the doctor when your blood pressure is high or when you're having a chest pain, we really do just really want to reiterate that this is a medical problem and there are medical answers. We're not just kind of, hoping that things get better. We're not just sitting around waiting for things to change. There is a true method to this. Like she said, there's just so much benefit that comes from that combination of medicines and therapy. And so it's just really, really so important that people understand that it is, a medical problem. And so we have to treat it that way, and we just have to reach out for the service.
Awesome. Well, thank you guys for that. Are there any other questions? Well, if not, then I just want to thank everyone again for attending tonight's Tough Topics discussion. Be sure to join us next week when we'll go over Louisiana's opioid preparedness plan with Yolanda Duckworth. And again, I thank you ladies so much for this great presentation and letting us know all about the great services that you guys are providing at Northwest Louisiana Human Services District. They are certainly invaluable, and we appreciate all that you do. We have one last comment. It says great presentation. So if there is nothing else to add, then we can wrap it up, and everyone have a great night. And thank you again for this great presentation.
Thank you for having us.